Glover Williams from St. Vincent.
Astrid Bala from St. Vincent.
Debbie Clark from St. Vincent.
Kimian Byron, St. Vincent.
Tisha Adams, St. Vincent.
Sally Ann Peters, St. Vincent.
Mal Hot, St. Kitts.
Roselle Solomon, St. Vincent.
Sharon Busso, St. Kitts.
Jessica Scarborough, Nevis.
Good morning, everyone. My name is Joanne Paul Pascal from Grenada.
Virginia Williams, St. Kitts and Nevis. Nicosia Fletcher, Grenada.
Anybody else?
Judy Nesbeth, Nevis.
All right. Some people introduced themselves on the chat, and thank you all for being here this morning. This is the screening and management module of the system. It is the largest module that involves everyone, from VCT providers to the clinical management team, the labs, pharmacy, central medical stores. Because of how large it is, we might spend more time than we usually spend on the other modules. The time slot we have here is 9 to 2. We'll definitely finish before 2, but we might use all of 9 to 12. There is no afternoon session because of how long it is. So we just put that time block for you to clear that time just in case we need up to the 5 hours every day. But we'll try to keep it under that because we know people have other agendas. And when the training stays for too long, then it becomes counterproductive. Okay, we're going to walk through the system. Some of you are already users who use the system every day, so this will be like a review. And some people are new, and we'll just look at it, and then we're going to use case scenarios. If you already have the manual, most of the things we'll discuss starts from page 50 of the manual. The manual is on the portal where you logged in as one of the resources, and the case scenarios. And you'll find case scenarios from page, I think it's going to be from page 179 thereabouts. So we're going to work with this, and if you need me to email you the manual and the scenarios again, I can do that, but it's already on the page for download if you want it. So I'll give a brief overview. I'll share my screen shortly and give an overview of the system so we can be on the same page. Hold on, let me share my screen. All right, so the case-based surveillance system, as we know, is a very large system that consists of the virtual training workshop portal, where we do our virtual workshop like we are doing here, where you logged into to join live sessions. This came up during COVID, actually, to be able to have somewhere where we can start having virtual workshop, organized workshops, and also certifications. If you need that resource within countries, it's there in a case base where you can actually have all of the trainings organized and structured, and people have an organized way of joining trainings in advance or be able to view a schedule, and also as a resource that you can use within countries to keep training constantly ongoing by the master trainers. Then we have the patient management and reporting system, which most of you do not have an account on, and we're going to create accounts the later part of the day for those who don't have. Now, the accounts will only be created for those who are present to practice and do the exercises. It's not going to be useful to those who are not here, as your accounts are created or will be created by your supervisors on your in-country live system. So you don't need a patient management and reporting system account on this system if not participating in the country. So when you put emails on the chat, just try to put the emails of those who are present. And then in order not to have confusions about where to log in and what we are doing. Then we have an API. The API training workshop starts November 11th, and I think it's more targeted towards program managers and IT staffs. Anybody is welcome to join. Invitations will go out by the first week in November for that training. The patient management and reporting system uses role-based authentication and permission-based authorizations. And when you log in with your email, registered email, and your password, you are authenticated to the home page of your assigned role. Now, there are 3 roles on the system. We have the screenings and management role, we have the monitoring and reporting role, and then we have the administration role. Everybody that is part of the clinical management team belongs to the screenings and management role. So all the accounts you will get for this exercise for this week is going to be assigned to screenings and management. Within the screenings and management, we have several permissions that allows you access to the part of the system that you are registered in. And so I'm going to log on as a user assigned screenings and management. Now, when you log on successfully, for those that don't have account here, don't worry about it. We'll create. For now, let's just follow and see what it is, and then we'll create accounts, and then we'll do the exercises. So once you log on as a user assigned a screening and management role, it now means your job function belongs to that category. Either you're a VCT provider, a tester in the lab, a clinic, belong to any part of the clinical management team or the pharmacy. This role has several permissions. On this particular account, I have given all permissions for us to be able to review all the permissions that it has, and then we're going to focus on only general population counseling and testing for today. The user assigned this role has different permissions that controls what you see and what it is that you can do on the system. When you assign the general population screenings, you have access to the drop-down menu for general population counseling and testing. For this permission, you can create a new client account. You can collect information about the client, record screenings, view screening history. You can update the client's information regardless of where the account was created, as long as you have the unique ID. You can look at all registered pregnancy at your site, the site you're assigned to. You can look at all of the records or the files that you accessed and the clients whose account you created, those you referred for care and management, those who were successfully registered into care and those who have not been registered into care, for you to be able to track and keep following up with your own clients. Then you can also record self-test kits distribution if you distribute at your site. If you have someone who comes for testing and needs condoms or self-test kits, you can record the distribution also. You can look at all of the HIV screenings that have been done at your assigned site, all of the syphilis screenings, all of the tuberculosis screenings, and any other screenings that were recorded at your site. And then you can also look at the client's treatment plan. So if you have a client who was referred for care and management in a clinic and is returning back to the health center, you can actually look at the treatment plan from the care card that the doctor had filled in from your page here. And so these are the functionalities you can perform if you see the general population counseling and testing drop-down menu. Every of the tester is also going to be assigned a referrals permission, where if you have a confirmed positive, you can now do the referral. So there are 3 types of referrals. You can refer for new HIV case for care, registration and management. You can refer TB cases for treatment and management, or you can refer other cases like for prevention. If you do prevention referral, or if you give PrEP for those whose risk history needs a risk reduction plan, and part of the plan is to maybe put them on any kind of treatment, or someone comes and is not positive for HIV or syphilis but has other STDs or hepatitis and you want to still refer the person for treatment and management, the referrals can be done here. So you refer based on what disease is confirmed positive. If the person is confirmed positive for HIV and you do the referral, the person will be referred to all services automatically for all STIs and prevention and TB. If the person is referred for just TB treatment, then the referral will just be TB, and then the registration into care will just be for TB. If the person is just referred for other STIs or any other kind of prevention service, then the care card will only have prevention services, no HIV. So HIV is the master. When you do HIV referral, it gives all referrals automatically. So if the person is positive for HIV, also has TB and has hepatitis, you can only do HIV referral and it refers for everything automatically. Then we'll have care registrations and initial evaluation. Once a client is referred, whoever is responsible for care registration will now see the profile of the person to click on and register the person into care when the person shows up at the clinic. This care registration initial evaluation or referral goes to 2 places. One goes to PMTCT and the other goes to the IDC clinic or whatever you name your clinic within the country. And so there'll be 2 levels of tracking. If the client is pregnant, automatically a PMTCT referral is done. And so the PMTCT coordinator can see it on their page that there's a new referral or a new pregnant positive. And we're going to look at the details. We'll just look at the overview of the functionalities. Now, when you refer for HIV, they can view all of the HIV care referrals, all of the TB care referrals, and all of the referrals for every other type of management. And then they can register into care for HIV, for syphilis or hepatitis, and also registration of exposed infants into care. Once those people are registered into care, then the initial clinical evaluation can now be done. And there are 3 levels of clinical evaluation, or 3 types. We have the adult initial clinical evaluation. We have the adolescent or the pregnant initial clinical evaluation. The forms for adult, pregnant, and adolescent are exactly the same. But then we now have a pediatric initial clinical evaluation that generates a totally different form. So you have to register or do the evaluation according to the category of the client. The definition of adult and pediatric has always been conflicting based on treatment, and so it's such that you decide within your country during referral if you want to place somebody who is 16, 15 as adult or adolescent, if you want to place them as pediatric. The system is now, unlike previously, will allow you to choose the category because there was a conflict with the definition of pediatric as it relates to HIV in the different countries. So some people want to place 16 in pediatrics, some people want to place them under adolescents and adults. So you can decide the category when you register into care if you're sending for pediatric or the adult clinic. So take note that adolescents and adults will have exactly the same form. So you can also do the exposed infant initial evaluation, and then those are the functionalities for care registrations and initial evaluation. So there's prevention and control and PMTCT functionality. This is where you can track the client's risk history. You can do a risk reduction plan, look at the risk reduction history, the contact that has been listed by the high risk client, and then you can report all of the contact tracing. If the people have been traced, they've been screened, or they've been referred to again for another prevention plan, or if they're positive for care and management. And then also if you are referring for pre-exposure or post-exposure prophylaxis. So anybody with the prevention control permission can actually see all of these functionalities and carry out these functionalities. Then we have the screenings category mortality update. This update is the part where if a client has come into the clinic maybe on Monday and you took samples for confirmatory tests, and the client, or maybe the result comes back on Tuesday, you don't need to go through the whole profile to request release and everything. You can come to update, just come to update here. And so everybody that has the updates permission, the lab, anybody, can just come to updates, enter the unique ID, and update just the screening without having to go through all of the verification, requesting of release of client's file, and going through all of the case information forms. You can come to update here to update just what you need to update. If a client was wrongly placed in the category and you have placed the client or referred the client as an adult, and the clinic says they want it as pediatric, then you can update the category of the client or change them from adult to pediatric. This controls the forms that are generated in the care card for the client. Then if a client dies, this is where you register the death of the client and choose the cause of death. Then we have the psychosocial support and adherence counseling, and this is the part where you can schedule counseling appointments and start an encounter. There are 3 types of encounter on the system. We have the pre-assessment to assess if the client is ready for adherence. We have the medication adherence assessment for returning clients who have been prescribed medications in the past to see if they were adherent to the medication before the next clinical management or before the next prescription. And then we have a strategy work plan for those, if you can't decide if they'll be adherent or not, and you want to place them on some trial medication to see how they are adherent to those medications before you try. Maybe you want to use multivitamins in the same dosing as the intended ARV to see how they can be adherent to it, to practice adherence before the actual medication comes in. So you choose the type of counseling appointment and decide what type of form to fill for the client. Then we have appointment and patient monitoring, and this is the part where you schedule clinical management appointments, or if you have timelines for CD4s and viral loads, you schedule the appointments for those tests. Also, you can also schedule counseling appointment from this part if you have the routine permissions. You can change appointment dates, you can create visits, record vital signs when a client who has an appointment shows up at the clinic. Then you can also view to see the adherence readiness information to see if this client is ready for adherence, depending on what the rules are. If you want to give medications to everybody, or you just want to give it to those who you think will be adherent to the medication. Then we have the monitor client, where you look to see the date of their last CD4 viral loads and see if anybody is due for one, if anybody's CD4 viral load is below, or it's at the point where you need to repeat a test to check for maybe treatment failure or whatever it is that you want to look at. You also look at the missed appointments of the clients from there. Then we'll have routine test and reset dates. This is where you book appointment for routine test, where you decide if the client doesn't need the test, you want to reset the date and say check back in 3 months or 6 months to see how they are doing. Or for those who have fluctuating CD4s and viral load, if you want to schedule an appointment for testing or a timeline for their testing to monitor the values. Then we'll have the clinical management part, where the doctors will actually see all of the list of those who have an appointment for the day and whose vital signs have been taken, who are already present in the clinic and waiting to be seen. And then the HIV care card gives you a tabbed page where you have several different forms for the different HIV management encounter recording. They have TB care card and care card for other STIs, and then where you can actually view previous clinical notes of the clients. Then we'll have the central medical stores and supplies, where the central medical store can create medication stock and enter the record of distribution to which pharmacies have whatever stock, and then the pharmacy can now record the stock that they have received, and then when they dispense and record the dispense on the system, it now deducts from the stock automatically and gives an alert for when a particular stock is running low or when they stock out. Also, whatever the pharmacy does here reflects on the clinical management. On the tab where the doctor prescribes or writes a treatment plan, the doctor is able to see what is available in stock and what is not available, and the dosing or the strengths that are available to guide their prescription, so they don't prescribe and then they don't have that in stock. So this is an overview of all the functionalities for screenings and management. We are going to focus on general population, counseling and testing, and then we are going to create all of your accounts. Does anyone have any question before we go on? All right, so I assume no one has questions, and then we'll look at general population, counseling and testing. When you have a new client who comes to the clinic and has no account on the system, has no record on the system, there is no way you will know if they have a record on the system or not, except when you ask them for their unique ID and they don't know what you're talking about, and then you ask them if they've tested before, where they tested. You can actually find out if the site uses the system, if they have an account, and ask them if they ever created an account on the system. If they say no, it is time to create a new account. That means the client has no account on the system. If the client has an account on the system, you want to get a unique ID. If they're sure they have an account on the system, but they don't know the unique ID, it is time to not create an account. You might want to, if the person is in a hurry or you can't reach your supervisor, you might want to use paper for that client so you don't have duplicate accounts for the client, and contact the supervisor with any of the client's detail you have is either first letter of first name, first letter of last name, first letter of mother maiden's name, the date of birth, the type of unique ID that is missing or that cannot be found, and the person has full names, you can send the full names to the supervisor, and the supervisor will search and retrieve the ID for you to be able to use the ID to retrieve the record to update the client's record. But if the client has no record, it is time for you to create a new one. So to create a new record, you come to the pages, drop-down menu, select General Population, Counseling and Testing, and create new client account. Now, what you do is one of the most important things, the screenings. If you don't create an account and do not have a screening record and do not do a referral, the rest of the parts of the system cannot be used by anybody on that client. So the most important part are this entry part, which is the work that you do, the screenings. The records that you collect is actually the most important for reporting. Almost all of the information you're going to collect are needed for the automatic reporting. So the reporter's information, that's the information about you filling in this. You want to find out if this person is pregnant and is coming in for antenatal. Whichever way, whether pregnant or not, the same account creation is what you're going to do. And so let's say the date is 14th of October, 2024. The contact of reporter, either your office number, your email address, whatever your supervisor can reach you on in the event that there's a missing record you didn't enter properly, or they just need information about the records that you have entered. So just enter any number and the facility type. Let's say we are doing this at the Testing and Counseling government site. So the first name of the client, let's create a hypothetical first name here. Let's say this name is, I'm not going to use the generic Jane Doe, but I'm going to make up a name. So if this name appears to be any of your names, don't feel offended, please. Let's say the name of this person is Agnes, the first name. And let's say the middle name is Sandra, and the last name, let's say Brown. And let's say the date of birth of Agnes is 8th of April, and let's give a year. Let's say 1995. Let's say Sandra is a biological female. The mother's maiden name, let's say, is Kenneth. And then the testing code is generated automatically, and there's a standard algorithm that is used in the OECS manual for testing code generation. It is on the left part of the page how the system generates this. It uses the first letter of the first name, the first letter of the mother's maiden name, the first letter of the last name, the last 2 digits of a 4-digit year of birth, and then the biological sex. F for female, M for male, I for intersex. Now, the unique ID is what uniquely identifies the client. Unique ID can be anything you want, you choose in the country. It can be their hospital registration number, driver's license number, any ID that is unique to that client. Any ID the person can always remember or work with in their wallet to always use the number to retrieve the record. Once they don't have that number, you can't retrieve their record. So you decide whatever is standard within the country. If you use the testing code as a unique ID, testing codes are not unique. You can have hundreds of people in the country that has the same first letter of first name, that has the same first letter of last name, mother's maiden name, and year of birth, and they have the same sex. So at that point, testing code is not unique, but the system, because it enforces uniqueness, will accept the first testing code when you use that testing code. But the next one that is the same as one that already exists will be rejected, and it will tell you that somebody is using this as a unique ID, you can no longer use it. So at that point, you need to use any other ID. So I'll make up a unique ID here. let me say I want to use the testing code and just say October. Another thing you can use as unique ID, if you wish and if it's easier for the client, is to just use their email address as the unique ID. Email addresses are unique. Okay, you can decide to use email address. Whatever you want to, you choose to use in the country. There is no rule to what the unique ID is. Just the person should just remember what it is that you use, and you want to make it secured because that is the only way anyone can have access to records. Yes, Lester?
Yeah, so I think that's a really good idea. Maybe we should really ask persons for email addresses and stuff. But I'll tell you what, for example, in Dominica, when we get a new passport, the passport number changes.
Yeah.
If I've been tested about 3 years ago and I got a new passport and the passport number changes, the same thing happens for a license, which is kind of really interesting because that number changes also. So is there a way, for example, if you bring up a testing code that is familiar in the system, that it is flagged, and you know, okay, that person has been tested already without having to put their unique code, but they put in a new unique code right now?
Yes, so we did that in the supervisors training where you can update the unique ID. So the person has a different passport that expires, that has expired, and they come in with a new one. You can now retrieve their account and just change the old ID to a new ID. It will change throughout the system and the new ID becomes their unique ID. Or you can make it easy for yourself. If they have email addresses, you can ask for their email address and you use it as their unique ID. But then they should remember, and it's not in all communities that people have email addresses, and that's why it was never suggested, because you can go for a community test drive and none of them actually have an email or have never used an email before. So you can just ask. Yes?
Yeah, but Minister, I just wanted to ask again. I probably asked you that before. Can't it search by the client's name?
Yes, you can search by first name, but that is if you have entered the name on the system. You know, it's not all countries that collect names. They just use first letter of the names. So if you did not enter the names when you were creating the accounts, you can search by the names because the name is not on the system.
Okay.
Yeah. So if in your country, in Dominica, you collect the names of the clients when they come for screenings, then you actually can search by the name on the system. I think most times the names are collected, right? I don't know who is here, who does screening. Most times you collect names or not? Who does testing? Is that? Sorry, somebody was talking.
Mildred, yes. I mean, I'm not doing screening or testing, but sometimes doctors put the name of the clients and then we ask them for code. So sometimes they come with their names from the doctors, and then for the next visit again we ask for the code and then we just put. So we have on our pickup cards the names, the addresses, telephone number, and their codes.
Okay. Yeah. So in that event, you can always retrieve the records by either the first name or the last name, or you can retrieve by the testing code. And when you retrieve by testing code, it will give you all the people that have the same testing code. If it's just that person, then it's easy. So if it gives you the information about everybody, you might not want to use the date of birth or the address or the gender or something to differentiate one from the other to know which unique ID belongs to who. Okay. So once you fill out this, let's say order, you select the unique ID type, and then you create account. Once the account is created, the next thing you want to do is this. The system, for security purpose, will not release a file of a client to anybody. You always need a unique ID. So once you log out and the client has left the clinic, except if you write their ID down somewhere, you cannot retrieve the record of that client. The only way you can retrieve the record is if you did the testing. You can see it on your list of the screenings done by you, but you can't just randomly enter or select a record of a client. If two people are in the same health center and person A did the screening, person B will not have access to that screening except they now have the unique ID of the client. Now, the system holds the files of every client, and you have to request release of a client's file before you can fill in any information. So once you create the account, you request release of the file. Requesting release of the file only makes the system log access to different clients' files. So if there's anything about a client, maybe a medical record leak about somebody and it's not like the database was exposed or something, then you can actually see the log of people who access the files and at the time they access. So you have to fill in the request release form for that client. So this is October, and the unique ID AKB 95F, and we want to do HIV screening, we want a TB screening, we want to do other STI screenings, and we'll submit. Once you do this, you have access to this client's record until 11:59 p.m. of the current day. If you fill this form at 11:58 p.m., exactly 11:59 p.m., the system will just the access back and you have to fill it again. So once you fill this release, it lasts for until the clock resets, until 11:59 p.m. So take note of that. When you do that, the links are arranged in the order in which you have to follow. You create the client account, you request release of client's file, then you collect client's information. Now you enter the unique ID. So this page gives you a lot of information, from the different flags of the basic summary of the client to the important behavioral information, and also links for you to start a risk reduction plan in the event that the client's risk behaviors needs a risk reduction plan. And then you can actually view all of the recorded risk history of the clients to see if their risk is getting worse, getting better, if the client is an existing client before and you want to look at their risk history, or compare new risks with the previous risks that they have to see if the risk reduction plan is working. In the event the plan is just about counseling and change of lifestyle or something. Then below here you have several tabs. If the biological sex of the client is female or intersex, you will have extra tabs like pregnancy history and new pregnancy registration, antenatal maternity routine follow-up. Everybody whose biological sex is male will not have these 3 tabs on their page. So when you open a client record and you don't find this pregnancy history and this, and the client is biological male, then it's all working fine. But if the client is not biological male, you will find everything about registering pregnancy and antenatal. When you create an account for a client, the system automatically creates a maternity universal unique identifier for every biological female and intersex on the system. So in the future, when they register for antenatal or when they come walk into the clinic, you can enter the same unique ID to just register that pregnancy on the system. We'll look at pregnancy registration and antenatal stuff maybe on Wednesday on the system. But this is just an overview of the tabs here. You have a personal information tab, you have a risk behavior tab, you have a comorbidity tab, you have the HIV screenings, TB screenings, syphilis screenings, and then other screenings. You have a contact listing tab where you enter extra notes and how you upload the screening results, and if you want to enter vaccination history of the client. If the client has collected self-test kits, you want to view their self-test history in the event that they were recording from home on the system. So let's look at the personal information tab. Here you collect demographic and personal information like it is. A lot of the information are needed for reporting, so you have to fill it in. Now, the first time the client walks in, you will spend on the average 15 to 20 minutes on their screenings, which include filling of these forms. The next time they come back, you don't have to fill these things again. All you need to do is to just use the updates and look if anything has changed. Ask them about their risk behaviors, ask them about their addresses, anything that have changed, you update. If not, you just record screenings and move on. So let's say the date of report is October 2024. When you're entering a past record, you put the dates on the record. So if I'm entering a record of 1979, the date here is going to be the date on that past record. If the client has several IDs that they want to use, or they want to register on the system in case when they misplace one or forget one, like somebody has an international passport, has a driver's license, wants to also register their email address, you can actually add all that types of IDs here. So it will be easy for you to switch IDs when they come in, and it will be easy for the search of missing unique ID also. It's not a required field, and so you don't need to fill in this. You want to focus more on the required fields. Date of birth is required because when we created the client's account, we already entered the date of birth. And so the system already puts what we've entered, so you don't enter the same information twice. The country of birth, you have to fill it in now. Let's say this person was born in, okay, let's say Antigua, and the person now lives in Dominica. Then the address in country of residence, let's say, and then the town, let's say the health district or wellness center, let's just use this, parish. Length of time in the country of screening, let's say this person has been here for 15 years. I hope the age allows 15 years. 1995, yeah. So the biological sex is already there. We entered that when we created the account. The gender identity now is what the client identifies as. The gender identity and the biological sex are not the same. So when you ask the question of their sex, people will most likely tell you what they identify as not their biological sex. So you want to be clear that you want to know the biological sex and you want to know what they identify as. So the biological sex is female. Let's say this person identifies as, let's say the person is female also, identifies as female. And then we have the sexual orientation. Let's say this person is bisexual, and the telephone number. Whatever is not required is not in red. Yes, Lester?
Right, so I realize, so it can probably make it a lot easier because there are some things that you're saying that will automatically stay for the first time that you interact with the client.
Yeah.
Country of birth will stay, just like date of birth will stay.
Yeah.
Biological sex will stay.
Yeah.
I don't think it's something that needs to be done again.
Mm-hmm.
So I think all of the things that can stay, ethnicity will stay. It means that those things we can just leave them as they are. I don't think somebody
Yes.
will change ethnicity, no?
No, we didn't collect ethnicity when we created the account. So the only thing that you don't see staying here, like this stayed, and you can't even edit it. The only thing we enter now is just here for information for you to see exactly what was filled in, since it's important for you to understand for this.
All right. Well, I mean, like for the country of birth, the same way that the date of birth would stay, I guess the country of birth would remain the same thing all the time, no?
Yeah, the country of birth will always stay the same because it doesn't change.
You drop them again.
No, which one? The country of birth? The country of birth, we entered that. The biological sex, we entered that when we're collecting when we're creating the account. But all of this country of birth and country of residence, we did not collect this information anywhere before. So we collect it now, and you don't need to collect it again. You understand?
Okay, no problem.
Yeah. So the marital status of this person, let's say single. The ethnicity now, let's say just occupation, let's say self-employed. We have highest level of education, let's say college, and number of sexual partners, 2 to 4. Type of sexual activity, and let's say, is the client currently pregnant? You only ask females this, and then you select yes or no. If it's a female, not applicable. If it's male or a child. So let's say for this person, no. Has the client's regular sexual partner be tested for HIV? Say unknown. Is the client alive or dead? The client is probably alive because the client is sitting in front of you. And the reason this question is here is because sometimes people come into the emergency room and then they die before the result is out. So you want to, when you're filling this form, you want to say if the client is alive or dead. Okay, so this one is alive. The cause of death is not applicable. And has the client left the country or reside elsewhere? And let's say yes. And you save. Once you save, you want to look through the tab and make sure everything saves by seeing the values retained in the field. So you don't need to, you see that everything is well here. You move on to the next tab, which is the risk behavior. Does anyone have a question?
No questions so far.
Okay. All right, so the risk behaviors is also important. You have to fill in this form. The date of report, today's date. Now, there is this temptation to say there is no time, we just need to move on fast and do the screenings is important. But when you do the screenings, you are using the system. You do the screenings, you record the screenings just to save time, and you don't fill the other forms. Then using the system is very useless at this point because the information and the data that needs to be collected is not being collected. So there is collecting data and collecting meaningful data. And so you want to try to go through the forms. It is better to spend an extra time to get your data complete than to start running end of the quarter to start looking for records or try to remember and make up stuff to fill the record sheet. So had sex with males, let's say the person said in the last 12 months. So most of the questions are either in the last 12 months, over 12 months ago, never, not applicable, and then there are some questions that are yes or no questions. So had sex with females, this person, and then you want to take note again of the answers. The person already said that they were bisexual, and the person is biological female and identifies as female, and then they might now tell you that had sex with females never, and then the answers they're giving you here and what you filled in as their sexual orientation will now be in conflict. So at this point, if it's something that you want to ask the person if the person understands the terms that are being used, or if you want to explain things deeper for you to have the correct information. So under normal circumstance, a female who says she's bisexual has had sex with females also. Had sex with persons of known HIV positive status. Let's say you ask the person, let's say the person says never. Had sex with sex workers, let's say she said never. Exchanged sex for drugs or material gain. Let's say the person says over 12 months ago. Shared needles while injecting non-prescription drugs. Let's say she said over 12 months ago. Crack cocaine or other illicit drug use. Let's say over 12 months ago. Had sex under the influence of drugs or alcohol over 12 months ago. Had sex with multiple partners. Now she has said that she has 2 to 4 sexual partners, so this is going to be in the last 12 months also. Then had perinatal exposure to HIV. I think one country has asked that this needs to be explained because they don't usually understand. And so the question to ask if the person has been exposed to HIV during the period they became pregnant or up to 1 year after having a baby. That is the definition of perinatal exposure to HIV. And so say not applicable or no. Receive a transfusion of blood or blood products or clotting factors, let's say never. Had occupational exposure while working in a healthcare settings or laboratory or providing safety or emergency services, let's say never. Been a victim of sexual assault, let's say never. Received a transplant of tissue or organ or artificial insemination, let's say never. Confirmed diagnosis of STI at the time of HIV testing. Now, this is only going to be applicable if, or is going to be in the last 12 months if the person tested positive for maybe syphilis and is now screening for HIV as routine. And at this point, it's going to be yes, but now at this point, it is not applicable or no. There's no confirmed diagnosis, there's no test, it's not applicable. Confirmed diagnosis of TB at the time of HIV testing, had contact with confirmed TB, let's say no or unknown. Been previously diagnosed with HIV, and this question only applies to if you are screening someone with TB for HIV, and it's not applicable. And then condom use of the person. This is also another area where there's a lot of confusion. The condom use part is, some people never use condom. They've never used it before. They don't even know what it looks like. They've never used condom. Never. Some people rarely use condom. Maybe they use once in a while. Rarely. Occasionally use condom is somebody who maybe with their regular sexual partner they don't use condom, with any other new sexual partner or with casual sexual partner they use condoms occasionally. Sometimes there is no rule to when they use condom. It depends on their mood on that day. Usually is majority of the times, except when condom is not available, always is they've never had sex without condom or they never do have sex without condom. So you will look at the condom use and look at the proper definition of always, usually, sometimes, occasionally, rarely, never, or not applicable will apply to maybe a child or someone who is not sexually active, or none will apply to somebody maybe unconscious and you're feeling this one. So let's say this person says occasionally, and is the client incarcerated or have a history of incarceration? Let's say said never. Has the client ever been homeless? Let's say over 12 months ago. Is the client a sex worker? Let's say never. Now again, this is another question where brings a kind of labeling, right? Some people are actually sex workers by what they do, but they don't identify as sex workers. And so if you want to ask if you're a sex worker or something, they might say no, but they actually exchange sex for money. So you want to see the difference between what this is and what the transactional sex is above there, and choose the appropriate answer. Most of the times you're not asking these questions or reading it out. You are rephrasing it to what is not, or what doesn't sound intrusive or offensive to the clients to get your correct answer. So as the client had sex with transgender female, let's say never, and then save. So when you go through these forms and you know the questions, sometimes you already ask all of these questions in your conversations, and you just start ticking without actually asking them out, because you know what the questions are. And by the time you finish exchanging greetings with the person, you would have asked half of the questions already. So we have the comorbidity, which is also important, and we'll fill in this. The person has diabetes, let's say no. Lymphoma, no. Renal disease, no. Let's say chronic lung disease, let's say no. High blood pressure, let's say yes. Others, let's say this person is has sickle cell disease, and let's say the person is HBSS. Let's alcoholism, let's say no. We don't know what the standard definition of alcoholism is. You define what alcoholism is in medical terms or within the country. If it's 6 or more bottles a day or every day of the week, if the person is always drunk, always staggering, if the person is not drunk, definition of alcoholism. Malnutrition, again, this is also conflicting in definition. You want to decide what it is. You can't see malnutrition on people's faces except if they are obese, but you can see it sometimes, but not everybody who is malnourished actually shows malnourished. So this again is another question where most of the time your answer will be unknown because you don't really know. Reason for test, you want to know why the person came in for testing. This is also for reporting, to know why people come in for tests. So let's say this is provider-initiated testing. Has the client been previously tested for HIV? If they tell you they've been tested or screened before somewhere, you say yes. If they know the location and the day, you can fill it in. If they've been previously diagnosed with HIV, you want to fill it in. If they've been previously diagnosed with any STI other than HIV, and then has the client been previously diagnosed with TB, and then you save. Now it is time for us to do the screenings. Anybody has questions before screenings?
Yes, Mildred.
Yes.
If for some reason, I don't do screening again, but if for some reason the clients change any of their screening patterns, like address or sex or out of prison, do you go back and do a thing, or you leave it like this?
You change it, so you come back to risk behavior, right? This you enter the date. So let's say this person is coming in on another day now. So you just come to the tab, and the only thing that has changed is that this person has gone to prison and is just released. So you come to, is the client incarcerated or have history of incarceration? You just put in the last 12 months and save. So the system doesn't overwrite, it just gives you a new risk history. So you can now look at the trends of risks of the client. So you now have 2 copies of risks with the 2 different dates. And then this is where you can compare risks for a risk reduction plan if you want to look at the 2 risks. So you never have to fill in everything. You only fill in what's changed or update what changed. But every time you have to put in the dates for the system to know the dates you change that stuff.
So that will be done for not just out of the prison, for every other thing, right? For like address or change of partner, whatever the questions you had before. So that can be changed for everything changed. So so the previous one will be deleted, or it will be on some.
No, the previous one will not be deleted. Like now we have 2 copies of risk behavior because I changed something. If I take this client's unique ID here, let's take the unique ID here, and I come to get the last recorded risk history of this client, and it now shows me the 2 different risk histories. No one is deleted. You just have them in containers to say at 10:13, this is what we filled. We change everything at 10:16, and we'll see the values. So nothing is deleted.
All right, thanks.
So the system doesn't overwrite, but what you see on the tab is the most recent values. So you don't see all of the previous values, you see just the most recent on the tab. If you want to look at history, you always follow the links that want to look at the history of all of what was recorded. Okay. So we want to do the HIV screenings. Now for HIV screening, depending on how you do your screenings within the country, you will fill in the 2 tests if you do use the 2 test kits. If you do them serially or parallel, you will write it whether you want to fill both, you want to do one at a time. You choose your test modality, and most of the time your test modality will be your facility, or you just put HTS index. There's no index on the list. You just put in, let's say this is a public service. Then we have the type of test, let's say HIV rapid test. Let's say we use Unigold first. So you can do both and record both at the same time, not to come back and do it twice. And let's say the results for both are reactive. And we'll put the date here. So this is updated. You come back to the tab, you find it here. In the event you have made a mistake, you can delete and re-enter the same screenings. So you have the list of all of the screenings that have been recorded. In some countries, once the person is reactive, you might draw samples to send to the lab for confirmatory test. So at this point, if you're taking sample for the person at this visit, or you're not taking sample, you're writing a lab form, a lab request form for them to go to the lab and do a confirmatory test, you will now put in, let's say, an ELISA test. And there's no need to fill type of test kit since they're going to be drawing their blood at the lab. And then the result here will be awaiting results, and then you put in the date. This way, if the person goes to a different health center or a different clinic or comes back to the same clinic another day, and you are not on call or on duty that day, whoever they meet can see it on their page that confirmatory test was requested. We are waiting for the result, because here the result is going to be blank. So they can follow up for the result if it has not been entered into the system or if the result has not returned. Then we have the TB screening also. The type of test drop-down menu is populated based on all of the tests that the administrator has set. We did that in the previous week, so we don't need to go about that. But if you don't see anything on the drop-down menu, it's not because it doesn't exist, it's because during our settings, we didn't put them there. But on your live systems, you will have them. So we have the date of report, today's date, and the type of test. Let's say we're using let's do a mantle test, and let's say the induration. Well, not on the first day you won't get the induration, but let's assume that this thing was done 3 days ago, and the person has come for you to read it. And let's say the duration is 15 millimeter, and we'll say this person is reactive. Submit this. So for mantle test, usually do you use the experts to confirm, or if the person has had BCG at birth, there's no point? The testers here, how do you do that in the country? Anybody?
What was the question again, Mildred?
Like when you do a mantle test, right, and the induration is over 5 millimeter, what do you do next? You refer them for X-ray, or
they refer to the doctor.
Refer to the doctor.
To the community health nurse.
Oh, okay. So, but the next step is it to
that is doing it in our country.
Okay, the community health nurse. Yes. So, but if the person happened to have had BCG at birth and the induration is just that because of the BCG reaction, how do you confirm to see that the person doesn't have the TB? Is it by X-ray, or you do the experts MTB?
They do the X-ray and they do the mantle test as well.
Okay, they do the X-ray. So we have that on the list. Whatever it is that you use to confirm TB will be on the list there, and then you will now have, let's say awaiting results here, and then we'll put that. Okay, so you're done with TB, and then take note that.
Hi, Mildred.
Yes.
Oh, okay. Sorry, I just got the last part of the comment, but the question I'm going to ask, it's okay. I'm seeing it there. Genex with MTB. Okay. This is what I was going to ask. Okay, so it's there. That's okay.
All right. So, but the thing is, it's not every time the person comes into the health center that you're doing TB screenings. So while we are going through all of this form, it's not everything you use in one day. So it might look hectic and a lot, but what your focus is personal information, risk behavior, comorbidities. The screening tabs, you use them according to what screenings you are doing for the person on that day. If the person is pregnant, do not use HIV, TB, and syphilis screening tabs. Register the pregnancy and use the screening tab on the pregnancy card. The reason is it won't generate the flags for the timelines of screenings for the person that is pregnant. It will always have a flag on their care card that this person has never had HIV or syphilis screening for the EMTCT goal. on that part. So if the person is pregnant, the person comes in for antenatal, to not record screenings on HIV, TB, syphilis tab. Always use the pregnancy tab. If the person has pregnancy, you see the forms here for HIV, TB, and syphilis. We'll look at that on Wednesday. So we do the syphilis screenings now. Let's say the day is today. And then the type of test. So let's say you send in both at the same time, right? VDRL and TPPA or TPHA or FTA, whichever you use for confirmatory. Right, and when we send that, the results will be awaiting. Let's say it's awaiting result. The date is today. And then we look at other screenings. If the person is maybe have other complaint, you just want to send for complete blood count or anything, you record it there. Anything that is not HIV, not TB, not syphilis, like you want to screen for hepatitis B or something, this is where you will enter that screening here. So we'll skip other screenings, but you'll know that this tab is here for you to enter any other screening that you want to do for the person. So if the person wants to test for gonorrhea, any other thing, you use this place. Contact listing. So let's say this person has an appointment to come back in 2 days' time, and the person is now here 2 days' time. You have received the result for the person. I want to simulate exactly what will happen when you return the next time. So you log in on a new day. This is a new day. You log in. You don't have to use the create new client account. You start from request release of client's file because it's a new day. You fill in the form for you to get the release. Or let's assume that the client is not here. You just received a bunch of results from the lab, from all the screenings requested. And let's say the lab is not using the system or did not record the system. You have the updates permission also, that you can come here and update screenings. So you don't have to go through the whole care card or request release. You just enter the unique ID of the client. And then get file. Now, this just gives you screening tabs to just work with the tabs. We have the HIV screening tab, and you can still see the results previously where it's awaiting. You have the TB screening tab, you have the syphilis, the other screenings, extra notes if you want to leave notes, if you want to upload any results, maybe you have a scanned copy, or if you are requesting a drug resistance testing for the person. So now the result is back for the ELISA test that was done, and so you want to put in the date. We're just assuming, let's just ignore the date that is the same. This was done in a public facility, ELISA, and the results now return positive, and then we put in the date. Now we want to update the syphilis too, and we'll say that this result returned for VDRL and for TPHA. Let's say it has a titer of 164. The result for VDRL was reactive, was positive for TPHA, and then the date is today. So we've put in all of this. This gives you all the history of the different recordings that was done. So anybody that comes here can see that the sample was taken on the 14th of October for both, and then the result is there. In real life situation, it won't be the same date, and you see what the result is. So you can see the history of all the recordings for the screening. So this is a shortcut to when you get the client's results and the client is not there, you're just trying to update all of the results that have been received on the system. So what you do is come to screenings category, mortality updates, and other stroke update screenings. So that's all you do. But let's assume that this is the time when the client is in the clinic, the client is available. Then if you have used the request release for client's file and you fill out the form and you now have the form released, then you come to collect client information, enter the unique ID, and then at this point you want to start risk reduction plan, talk to the client, whatever it is, you need your extra notes for whatever it is. If you're telling the clients that the client has been confirmed positive, whatever you discuss, if the client has been referred, you leave it in the extra notes. So if they go to other clinics, or if the client wants another test, a repeat test, or anything you do, leave it in the additional notes. Now this person is positive also. You might want to do contact listing, right? The client has said she has 2 to 4 sexual partners. You might want to now list the contacts for tracing. So let's say first name of contact, let's say the name of this person is Drew, other names of contact, or the name that the person is known by the most in the community. You can write it, the last name of contact if they have it, let's say. And then we have the address of contact. They can give you the address of the contact, let's say number 15. Fame Street. Then the phone number of the contact. If they have the phone number, then let's put a phone number. And then the sex of the contact. At this point, you might want to use the biological sex of the contact. We'll put, let's say the sex of this contact is male, and you save. If the person has up to 5 contacts they want to list, you'll save and keep entering all of the contacts. So the person who has the contact tracing permission for prevention and control is going to see the full information, but you can only see the contact code and the contact name and the date listed. You just list the contact, whoever is assigned to contact tracing will see the full information. So once you are done with all of this person is pregnant, this person is not pregnant, and this person is female, and this person is positive, you are going to come to referrals tab. You refer new HIV case for care registration and management. You put a date of referral here, and then the unique ID of the client. And the category. So now this is where you select where this person belongs to. So this one is an adult, and you refer. Once referral is successful, you are done. You direct the person to the clinic where they have been referred to, or wherever it is that all referrals go to. And your job with these clients has been done until they return again. In some places, HIV care is integrated into primary health care, so they might return again to the health center. If not, if they keep going to, there's a dedicated clinic for that, then they keep going there. If not, you will see them again soon. But for now, the job is done. The positive, you refer. If this person wasn't positive, and maybe is a sex worker and has 10 to 20 sexual partners, then your referral will be for risk reduction. So you come to referral, and you're going to be referring for other treatment and management, prevention, STDs, and viral hepatitis. This is a referral you'll be using. If the person was positive for TB, or was positive for any TB screening, and the person is negative for HIV, then you'll be using refer TB. This person was positive for TB and HIV. Referring for HIV covers everything, because at the clinic, TB is also covered and other STIs are also covered. Okay? Anybody has question?
May I add just a question, just a point I want to make.
Okay.
When you do the screening for the client, and you look at the risk factors and everything, and there's an area that says extra notes when you're doing your screening.
Yeah.
One of the things I realized that a lot of counselors, testing DCT providers and PITCD don't do is put notes there in that extra note. So in that note, you can add, if you have a discussion with the client about condoms, and let's say they're saying they're allergic to latex condoms, but you give them information on some other type of condom that they can use, the polyurethane. You can put it there. It could also be where after the counseling session, you encourage them to have their partners come and get tested. You can also put that in the extra notes, because what can happen when you're looking at the client again, if the client comes to you, in those notes there you can pick up themes or patterns for the client. So I just want it for everybody's knowledge. You can put those notes there, so somebody else who's doing the test for the client, when it comes up, you can get themes and patterns from the just the notes that you're putting.
Yeah. That's actually a very good solution. Yeah, so the notes actually exist for such things because the other next time it might be somebody else the person meets, or it might go to a different testing site or a different health center.
Because there are times we give our clients condoms, but it's not reflected in what you're putting out. Like all of this information that we are filling into this form, but you give the client 6 condoms, or you encourage them to have their partners come and get tested, or you give them information, let's say on something like having a pap smear done, because in the discussion something came up that they feel uncomfortable in their vaginal region or in the penile region or whatever. You can put those notes there, so the next time they come, whoever is doing the test, the counseling session for them, can pull out, can look at that notes and see. I can ask, well, Mr. Guy did that for you 6 months ago. Did you go have the pap smear done? The pap smear done. So you have an opportunity to reestablish or re-inform the clients on information that they will have given the last time they came for testing.
Yeah. Yeah, very good point. Thank you so much, Lester. Does anybody have any other contribution or questions? All right, so I'll ask the next question. Does everybody understand? Is it clear this part we have looked at? I am not getting any response, so I'm feeling
yes, like at least it's clear for me.
Okay. Anybody wants me to go over again? All right, so we're going to look at a case scenario, and the case scenario will help us better in filling out this more accurately. Let me see if I have any case scenario typed out. Okay, can you see the case on the screen?
Yes, that's it.
Okay. So Jeff is a 40-year-old married to a female father of 2 children who has a male partner for casual sex. He lives at 25 Halfway House, Grand Estate, Rivertown, Parkland. Jeff has 5 to 9 sexual partners. He is heterosexual but romantically attracted to more than one gender. He uses alcohol occasionally and smokes tobacco to curb his anxiety. He recently had an anal unprotected sexual encounter with a new female friend he met at a party and shared needles injecting drugs. 4 months ago, he had a gonorrhea and chlamydia infection. He was treated with 20 milligrams of gentamicin and 2 grams of azithromycin orally. He is allergic to cephalosporins, and he presents at your health center today with lesions on the palm of his hand. he received a transfusion of platelets for hemorrhagic fever during his high school years. Due to his risk behaviors, he was screened for hepatitis B, HTLV, HIV, and syphilis through routine serological testing at the STI clinic. His results returned with a reactive alpha VDRL with a titer of 164 and non-reactive TPPA. It has to be reactive actually. Let's say it's reactive TPPA. He couldn't recall being treated for syphilis previously. He was told to ask his wife and partners to come in for screening and treatment. Jeff does not want to tell his wife, but is aware that she's at risk. So let's see how to fill this information with the story. Now, the reason we're using case information is what I filled in as an example just now is straightforward. Somebody walks in, the person is talking. What if somebody comes into the emergency room with a relative? The person is already at the point where the relative is answering questions and you need to get a story or a history that you use to fill into the system. Or you have different dynamics of person A walks in and you finish the screening, person B walks in, the gist and the whole stories and discussion are dynamic and are different. So let's work with what Jeff is and how we can fill in the information correctly. So Jeff has no account on the system. The story says that Jeff is 40 years old. So which means that Jeff would have been born in 1984. So we're going to create this account and look at his. So then put anything for contact and facility type. Let's say emergency room. The first name of the person we know is Jeff. We don't know the middle name. Last name is unknown. If it's unknown, you just use unknown. The date of birth, we don't know the day, we don't know the month, but they said he's 40 years old. So we know he was born in 1984. So I would advise you to just put 1st of January of the year. That's just for the system to let you go. 1984 is the focus. The sex of Jeff is
Male.
Is male because he said he's heterosexual. The mother's maiden name was not given, so it's unknown. And the testing code will be generated automatically. We want to have a unique ID for Jeff. Let's say we use this testing code and we just use, let me just use this.
October.
Yeah. And then the unique ID type, let's say other. So now the next thing we want to do is to request release of Jeff's file.
To generate the code, you have to provide all information. If you don't have information, as you just mentioned, like the mother's maiden name, you do what?
You use unknown.
Okay. Just confirming, okay.
All right. So we request the release of the file. And then we enter the unique ID. Now we want to screen for everything. So we want to collect information. Now, the personal information of Jeff. Let's fill in the date. Oh, today is 14th. It's a long day already. My brain has already entered a new day. Okay, so we don't have other IDs. The date of birth is already here. The country of birth of Jeff. Let's say Jeff was born in Barbados. We'll just look on what is closer here. And Jeff resides in, let's use Antigua. The address in the country of residence, let's say 111 Country Road. And then the town, let's say the town is St. John's. Now the Health District or Wellness Center, let's say Antigua, the parish, the length of time in the country of screening. Let's say Jeff has never left this. The story asks, let's see whether it tells us whether he has left the country before. So there's no part that tells us about if this person has left the country or has not left the country. We use the age as the length of time in country of screening. The gender identity, he is male. He identifies as male because he is married to a female, and sexual orientation is bisexual because the story says that he has a male partner for casual sex. So we have the phone number. The marital status is married. He is married. His ethnicity is I think the ethnicity wasn't given. So we don't have the ethnicity. We're going to select, I don't have the unknown option. Okay, there's unknown. And then we have occupation. He didn't tell us about the occupation here, so we also say unknown. The highest level of education, we don't know about his education, we put unknown. The number of sexual partners, he said he is married, he has one, he has 5 to 9 sexual partners. That means he has between 5 to 9 sexual partners. The type of sexual activity, he said he had anal sex. He has a wife, so he has vaginal sex also. So we don't know about oral sex. The story did not tell us that. Is he currently pregnant? He's not a female. Has his regular sexual partner been tested for HIV? No, because he said he doesn't want to tell his partners. Is he dead or alive? He's alive. Cause of death is not applicable. Has he left the country or reside elsewhere? We don't know. The story did not tell us. Okay, so there are some important field. So this is another point we need to look at. Whenever you save, you have to read your information if you have entered the information correctly. So this is telling me that I've not entered some important reporting information, so it is going to reject what I have filled in. Sometimes we just see success, or we see something we don't read, we just assume it has gone through. But so reading the information sees that it hasn't gone through, so the important information that needs to be collected. So it now means that you're going to do the same work all over again and make sure that all important information are collected. So we have the country of birth and country of residence we're not saved in, but we have the health district parish saved, with gender identity was not saved, and all this is in the events that something was conflicting. So we're going to fill it properly now. So put the country of birth here, let's say Antigua, country of residence, let's use Antigua. Let's come back to length of time in country of screening, we'll put 40, gender identity, male, sexual orientation, let's say bisexual, and then the marital status, married, the ethnicity, let's say the person is black. Occupation, here, I will say employed. These are the things we didn't feel that was important. And number of sexual partners, we already know it was 5 to 9. And then the not applicable, as the regular sexual partner be tested for HIV, no, alive, and not applicable. So we say unknown, or let's say no, and then save. Now it's updated. You have to have that success message or updated message. So because there's automatic reporting, once an important reporting information is not filled in, it will alert you to that. Even if it accepts some values, it will reject the values that are in that group of important information that you did not collect. Okay? Now we have to collect the risk behaviors. The date of report is 14th of October 2024. Now, had sex with males in the last 12 months, had sex with females in the last 12 months. This is based on the story. Had sex with persons of known HIV positive status. Let's say he said never. Had sex with sex workers. The story did not say he has had sex with sex workers. So we'll say never. Exchange sex for drugs, money, or material gain. Yes, it says that he had anal unprotected sexual encounter with a new male friend he met at a party and shared needles while injecting drugs. So this one might be never or not applicable, and the shared needles while injecting non-prescription drugs will be in the last 12 months. crack cocaine or illicit drug use. Let's say he uses drugs in the last 12 months, has sex under the influence of drug and alcohol. He said he uses alcohol occasionally and smokes tobacco to curb his anxiety. It's not clear if he had sex under the influence of drugs and alcohol, and we'll say unknown. And had sex with multiple partners in the last 12 months, had perinatal exposure to HIV, not applicable because he's male, received a transfusion of blood product or clotting factor. They said that he had received platelet transfusion when he was in high school, so about 12 months ago. Had occupational exposure while working in a healthcare settings or laboratory, never. Been a victim of sexual assault. He didn't tell us in the story. We don't know. Receive a transplant of tissue or organ or artificial insemination. Let's say never. Confirmed diagnosis of STI at the time of HIV testing. So the story said that he's just been screened now. And he told us about the results. But he had gonorrhea and chlamydia infection, which was already treated 4 months ago. So this is no at this point. Confirmed diagnosis of TB, no. Had contact with confirmed TB, no. Previously diagnosed for HIV, no. Condom use. He had anal unprotected sexual encounter, which means that sometimes they didn't say anything about condoms here. But they talk about unprotected sex. So let's say he occasionally uses condom, or we don't know about his condom use. Is the client incarcerated or have history of that? Let's say he says never, or he doesn't have that here. Has the client ever been homeless? Let's just put unknown for what we don't know, which is supposed to be what we'll feel in real life. Not a sex worker. Has the client had sex with transgender female? We don't know. And we save this. So we've saved the risk information. Comorbidities and others. So his medical history, he's not diabetic, he has no renal disease or lymphoma or high blood pressure from the story. So we'll just put in the date and fill in either unknown or no. So diabetes, lymphoma, renal disease, chronic lung disease, high blood pressure, and others. There is no disease that is specified here that he has. Alcoholism, we'll say no. He said he occasionally uses alcohol. Malnutrition, let's say no. Reason for test, possible exposure. Has the client been previously treated for HIV? Tested for HIV? No. Diagnosed with HIV previously? No. Diagnosed with STI and HIV? Yes. We say 4 months ago. So let's just assume that 4 months ago was June. And then has the client been previously diagnosed with TB? We'll say no. So this is how you feel based on a scenario. Now, he came in for HIV screening, and he was screened for hepatitis B, HTLV, and syphilis. So let's screen for HIV. HIV is not reactive. And now he was screened for syphilis. We have the VDRL, we have the TPHA, the titer is 1. the result is positive and the date. And then other screenings. They had HCLV and hepatitis B. So put in the dates. I don't think we have HCLV on the list for this trial system. We don't have it on the list. Yeah, but to have HCLV on the list is going to be on the list on your life system actually. I can just add it to the list now. So we see what happens when you don't have something on the list.
So it's the supervisor who does that?
Yes, the supervisor does that. So once you don't find something on the list, it's the supervisor you ask to add that to the list for you to see it on the drop-down menu. So now we can do HCLV screening. And let's say awaiting result, date. Okay, this gives us the result already. We have the result here already. It's only the syphilis that is positive. So this and hepatitis B. Oh, I would have added hepatitis when I did the other, so but we'll just ignore that. So here we'll put the result here to be negative according to the story 2024 and save. So you've filled in all of this, and he was asked to tell his wife and partners, and so that's what Lester said. Extra notes here, you can now put that here. Maybe you talk about he was giving condom. Let's just write anything. 5 packs of condoms, 3 self-test kits, and asked to discuss with sexual partners to come in for screening and prep or something, and risk reduction plan. Okay, so my system wants to correct me. Obviously it thinks I can't speak English, so I'm going to just accept what the system says and save. So you have that note there. So anybody who comes in, they go to other sites, or they come on a different day where the first person who saw them is not there, you can actually look at the notes to see what's next. So at this point, this person is going to be referred to the prevention clinic. If you are doing prevention in the same clinic, you just do the referral on the system and fill in the information there. We are not doing prevention today, but we'll just fill it in the referral. So we'll click on refer for other treatment and management, prevention, STDs, viral hepatitis. The date of referral is today. And the unique ID of the client. and the category is adult, and refer. So successful, and your job is done for this day and for this case. Does anyone have any question so far? So is it clear? Is it understandable?
Yes, it is.
Yes, it is.
Okay. So this case scenario that we just looked at exists on the manual, or I can actually put it on the page for you to download again. But for now, we will create everybody's account so that we'll have our account to do the exercises. Okay. So I don't know who doesn't have an account yet, so I'll log out. Again, if you have ever been able to successfully log into patient management and reporting system, it means you have an account. I'm going to see the accounts that we have. I will stop recording because this will expose people's names and email addresses. So I'll pause recording. Where's recording?